In this session, we will explore the worlds of real-world evidence and real-world data, two concepts revolutionizing the landscape of healthcare and pharmaceutical research. Imagine that we are standing at the crossroads of healthcare innovation. On one path, we have traditional clinical trials, which are the gold standards of medical research for decades. On the other path, a newer, dynamic path is emerging, paved with real world evidence and real world data. This path is reshaping how we understand and apply medical knowledge in real world settings. Let's first talk about the concept of real world data. Real world data is the raw data gathered from everyday experiences of patients. It is not data from controlled clinical trials, but rather from routine healthcare scenarios. This includes information from electronic health records, insurance claims, patients' registries, and even data from wearable health devices or even social media can be used as source of real-world data. It's like collecting pieces from various puzzles. Each piece represents a different aspect of patient care and experience. Now, from this mosaic of real world data emerges real world evidence. Think of real world evidence as the picture that comes into focus when we put these puzzle pieces together. It's the insights we gain by analyzing real world data. This evidence provides us with deeper understanding of how treatments work in diverse and messy real world outside the controlled environment of clinical trials. It answers questions about the effectiveness, safety, and cost effectiveness of treatments when used in day-to-day medical practice. The beauty of real-world evidence lies in its ability to fill the gaps left by traditional research methods. It offers a more informative view of healthcare, one that reflects the complexities and variabilities of real patient populations. For instance, real-world evidence can show how a drug performs in patients with multiple health conditions, something that's often not captured in clinical trials. Moreover, real-world evidence is becoming increasingly important in decision-making processes in healthcare. Regulatory bodies like the FDA are beginning to recognize the value of real world evidence in supplementing clinical trial data, especially for monitoring post market safety and effectiveness. Healthcare providers are using real world evidence to make more informed treatment decisions, and payers are looking at real world evidence to decide on drug reimbursements. To summarize, the introduction of real-world evidence and real-world data into healthcare landscape is like opening a new chapter in medical research and patient care. It's a chapter where the story is richer, more diverse, and more reflective of the real world. For professionals in the healthcare and pharmaceutical sectors, understanding and leveraging real-world evidence and real-world data is becoming essential for advancing patient care and driving innovation. So, what is the critical role of real-world evidence in transforming healthcare and pharmaceutical industry? Imagine a world where medical treatments are not just based on controlled clinical trials, but also on how they perform in real-life scenarios. This is where real-world evidence steps in, bridging the gap between clinical research and everyday healthcare clinical practice. Firstly, consider the enhanced drug development and approval processes. Real-world evidence acts as a vital component to clinical trials, offering insights into drug performance across diverse patient populations. It's like having an extra lens that provides a clearer, broader view. This evidence is increasingly used by regulatory bodies such as the FDA to speed up the approval of critical medications, especially those addressing unmet medical needs. Then there is the aspect of improved patient outcomes, personalized medicine. Real world evidence sheds light on how different patients respond to treatments, paving the way for tailored healthcare solutions. It's like fine tuning a musical instrument to play the perfect melody for each individual. In the world of informing healthcare policies and practices, real world evidence is a game changer. It guides healthcare providers and policymakers in making evidence based decisions, leading to more effective clinical guidelines and healthcare policies. Think of it as a compass guiding the vast ship of healthcare towards more efficient and effective practices, refining the results of clinical trials and adding more value to the outcomes. Real world data comes from multiple sources, each source contributing its unique stream of data. At the heart of this reservoir of data or sources are the electronic health records. These digital records are like detailed maps of a patient healthcare journey, charting everything from medical history to treatment outcomes. They offer a comprehensive view of a patient care over time, essential for understanding long term health trends. Then we have the claims and billing data, including health insurance claims. Think of this as the economic blueprint of healthcare, revealing the patterns of healthcare usage and costs. It's like looking at the healthcare system through financial lens, understanding not just the what and how of the treatment, but also the how much. Moving on, consider the patient registries. These are akin to specialized libraries, each focusing on specific condition or treatment. They provide valuable chapters in the story of long term healthcare outcomes, helping us understand the effectiveness of various interventions over extended periods of time. Now, let's look also to patient generated data. This data comes directly from the patients, often through wearable devices or health apps. It's like having a daily diary entry for each patient, offering insights into their lifestyle, behavior, treatment adherence in real world settings in a very close follow up manner. Also, pharmacy dispensing data is another key source. Picture this as a checkpoint in the medication journey, tracking what medications are prescribed and when they are dispensed. It's crucial for understanding how medications are used in the real world, not in the clinical trial, outside the controlled environment. We also draw insights from laboratory results. There are the hard facts, the objective measures of health like blood tests, biopsies, and others. They provide a clear, unambiguous picture of a patient's health status and how it changes over time. Then there are health surveys and patients' reported outcomes. Imagine sitting down with patients and hearing their stories firsthand. These surveys give patients a voice, allowing them to share their experiences, satisfaction with treatments, and quality of life. Lastly, in our digital world, social media and online platforms have emerged as novel sources of real world data. They are like open forums where patients share their experiences, concerns, and offering a real time pulse of patients' communities. So, real world evidence is a crucial component in healthcare and pharmaceutical research, providing insights into how treatments perform outside of controlled clinical trials. However, real world evidence and real world data come with certain limitations that must be acknowledged and addressed. Let's start by considering the quality and consistency of data that forms the backbone of real-world evidence. The data sources for real-world evidence are diverse, ranging from electronic health records to insurance claims to wearable devices, as we discussed before. Each of these sources has its own standards and levels of detail, leading to variability in the data collected. Moreover, we often encounter the challenge of incomplete and inaccurately recorded data, which can skew the evidence and lead to unreliable conclusions. Another critical aspect is the lack of randomization in real-world evidence studies. Unlike controlled environment of randomized trials, real-world evidence does not typically involve random assignment of treatments. This absence of randomization can introduce selection bias and confounding factors, making it more challenging to establish a clear cause and effect relationship between the treatment and its outcomes. The heterogeneity of patient populations also represents a unique challenge when it comes to real-world evidence, because real-world data reflects a wide array of patient demographics, health conditions, and the treatment adherence levels. While this diversity is a strength from one side, offering a more realistic view of patient experiences, it also complicates the interpretation of data. Drawing broad conclusions from such varied patient groups requires careful analysis and consideration. Ethical and regulatory considerations are paramount in real-world evidence studies. The use of patient data raises significant privacy and ethical issues, ensuring compliance with data protection laws. It is not just a legal requirement but a moral imperative. Additionally, while regulatory bodies are increasingly recognizing the value of real-world evidence, its acceptance for certain regulatory decisions remains a work in progress. The analytical and methodological challenges of real-world evidence cannot also be overlooked. Dealing with unstructured and varied data necessitates sophisticated statistical methods and expertise. The lack of standardized methodologies for conducting real-world evidence studies further adds to the complexity, leading to variability in study quality and outcomes. Lastly, the resource-intensive nature of real-world evidence is a factor that cannot be ignored. Collecting, analyzing, and interpreting real-world evidence requires significant investment in terms of time, technology, and expertise. This makes it a demanding resort and yet a rewarding one. To conclude this about the limitation of real world evidence, we can say that while real world evidence offers a new horizon, a window into the real world application of treatments, its limitations remind us of the need for meticulous study design, robust data analysis, and thoughtful interpretation. For healthcare and pharmaceutical professionals, understanding and addressing these limitations is very important in order to utilize the full potential of real world evidence in improving patient care and advancing medical research. Let's compare the two pivotal elements in medical research and pharmaceutical development: real world evidence and randomized controlled trials. Both play crucial roles, yet they differ significantly in their approaches and applications. Randomized controlled trials are the gold standard of clinical research. They are like meticulously planned experiments conducted in controlled environments. Patients are randomly assigned to either the treatment group or the control group, ensuring that the only significant difference between these groups is the treatment itself or the intervention itself. This design minimizes bias and provides high quality evidence on the efficacy and safety of a treatment under ideal conditions, controlled conditions. Randomized controlled trials are the gold standards and the bedrock upon which regulatory approvals and clinical guidelines are often based. Now, let's picture real world evidence as the real world counterpart of these controlled trials. Real world evidence studies are like taking a snapshot of everyday clinical practice. They utilize data from electronic health records, as we said, insurance claims, patient registries, wearable devices, and other sources. This data reflects the diverse experiences of patients in the real world setting, including various populations that might be underrepresented in clinical trials, like, for example, the elderly or those with multiple comorbidities, often excluded from clinical trials. When we compare these two randomized controlled trials and real world evidence, several aspects stand out. The generalization. Randomized controlled trials, while highly controlled, they often have strict inclusion criteria, limiting their generalization. In contrast, real world evidence provides a broader view applicable to a more diverse patient population. Another aspect is the timelines and feasibility. Conducting randomized controlled trial is time consuming and, of course, very expensive. Real world evidence, on the other hand, can often be gathered more quickly and at a lower cost using existing data sources. The third aspect is the scope of data. Randomized controlled trials are typically focused on specific outcomes. Real world evidence, on the other hand, can offer a wider range of insights, including long term effectiveness, quality of life, patient adherence to treatment. Another aspect is the regulatory perspective. Traditionally, randomized controlled trials have been the preferred source of evidence for regulatory approvals. However, there is a growing recognition nowadays of the value of real world evidence, especially in post marketing surveillance and in situations where randomized controlled trials are not feasible. So, which one is better? Which one is preferred? The answer is not as straightforward as we may think. It depends on the context. For initial drug approvals and understanding the fundamental efficacy and safety of a new medication, randomized controlled trials are often indispensable. However, for understanding how the drug performs in the broader, more varied context of everyday healthcare, real world evidence becomes invaluable. In the end, real world evidence and randomized clinical trials both are not competitors but complements. Together, they provide a more holistic approach, a more complete picture of the treatment impact from controlled environments to the varied environment of real world healthcare settings. For professionals in the pharmaceutical and healthcare industries, appreciating the strengths and limitations of both real world evidence and randomized controlled trials is key to making informed decisions that enhance patient care and advance medical knowledge.